Here's a little additional festive episode of the Conveners just to finish off 2024 and take a brief look ahead to 2025 with my good friend and colleague, Mr. John Oxley, CEO of Life Leisure and fellow board member of Geomactic, of course. It's been a fascinating year for our sector, and even more fascinating meeting so many interesting people on the Conveners. I've learned so much personally and feel honoured to have the opportunity to meet so many people doing such great work across our system. With ongoing support from the incredibly supportive team at Future Fit for Business, we've got some really exciting developments lined up for 2025 and I can't wait to get stuck into, to be honest. So John and I took the opportunity for a natter, as we do, about some of the highlights of 2024 and what we know will be an even more incredible 2025 coming up. Merry Christmas, folks, and best wishes for a stomping 2025.
Right then, this is a real treat for me. So here we are at, where are we again, John?
We're at Holdsworth Village in Stockport.
We are exactly at Holdsworth Village at Stockport. It's another episode of the Conveners, and it's sort of wrapping up 2024, which is no better person to do it with than Mr. John Oxley, who was my original co-host on the Conveners. So we thought we'd just take a little bit of time just to sort of look back over 2024 and then have a look forward into 2025 and what we're hoping might come about, what we're expecting to come about, and perhaps what we're dreading to come about as well. So, John, welcome.
Thank you. Privilege.
Absolutely, for me. So let's have a look then. So going back over 2024, on a national level, more often than regional, local, what have been some of the highlights or lowlights?
Great question. I sort of think when I reflect on 2024, I probably would go back to maybe some of the conversations you and I were having in 2021, 2022, and it probably took us that long for things to really start to ignite and the dial really starting to shift. So I think 2024 for me has been that the year where we started to have serious conversations about properly connecting physical activity and health at a local community level and properly understand what that meant. And I think that what we've seen then over that time is the stuff that we were talking about, as I say, a couple of years ago, but that was just amongst ourselves and at a very localized level. Now we're having that conversation at a national level. And I think we've got a greater proportion of the sector have got adherence to that concept. We're starting to see that behaviour, that change of behaviour from those involved, that leaders in those organisations who can affect that at greater scale than we've had before. And I think what we then did, and I think when I look back, that sort of first quarter of 2024, though, we were starting to have those conversations, and of course then the big thing, I think then in the middle of the year we got a new central national government.
Yeah.
And there was this anticipation then as to, does the stuff that we're really starting to talk about, can we land that and it start to appear as part of the new government's mission-led agenda, and I think I'm hopeful. So I think generally that's been the main theme around 2024. And obviously there's been little things that we might want to talk about. Very quickly after that we had the Darcy reports, first Darcy report on the NHS, which was about the health delivery system, but the second report was around prevention. Hooray! That's that's where that's the place that we want to play. We've then had UK Active and the ICB exemplars, another big moment. Forging that connection. So I mean, those are just some of
what about in terms of how that sort of collaboration manifested itself through the year? So you've been very much involved in this new place partnership, haven't you, with
Leadership
Network
Westall
and the club? Just tell us a little bit about that.
Well, I think that's perhaps some of the things that when I think back, so probably March time some of the bigger organisations got to the UK Active, local government association. The local government association, critically important to the whole landscape. Local government is the deliverer of so many services.
Yeah.
And we were starting to have that conversation, and that very quickly grew into this sort of, we call it a sort of leadership network without boundaries. Nobody's excluded. And the great thing about that is that over that time, 6 months only really, we've had terrific engagement from national organisations, but also organisations that you don't hear necessarily lots of noise about, but in the context of improving population health and understanding that population is affected most dramatically when you turn inactive people into active people, and you start to work with those who need movement the most. And we've had people come along to that network in that Street Games national organisation, but also local deliverers, women in sport, again another traditionally excluded population group, disadvantaged, underserved, and what have you. So all of that collective has really started to build some momentum, and we're really starting to apply our minds to how does that continue to develop. And when you've got those sort of organisations of national influence, where you've got other people who are doing it on the ground at a local place level, and that dialogue happening, then I think it's really quite an enriching environment to have that level of dialogue, because everybody then starts to appreciate, first of all, the breadth and depth of the sector, but also the complexity of things. But you can't have enough, dialogue sometimes, because it broadens your perspective and broadens your understanding. And the broader your understanding, the more capable you are of then influencing at a decision-making level, whether that be at a local government level or at a national government level.
Yeah, that sounds good. So just staying with that for a minute, who isn't possibly around that table that you would ideally like to see around the table?
Oh, that's a good question. I mean, I think we have got lots of people, we've got UK Active there, we've got the National Active Partnership Group, we've got Sport England there, we've got Richmond Group of Charities, we've got OHID there, we've got DCMS there, so you've got some pretty decent things. And then you've got sort of little people like me, and in more ways than one, but who are trying their best at a local level, and different people who we know that are involved. So is there anybody, we've got public health representation there, so we're genuinely trying to cover lots and lots of bases. Do I think that we've could we be broader? I think one of the things that the question that I would or the response that I would give you is that if I think about what we do locally and where I think our dialogue could be better, and our level of collaboration could be better, so that physical activity can have more impact upon population health and those who are dealing with, then adult social care, children's services, and our ability to impact, work more collaboratively with those. Health is relatively straightforward, because those relationships do exist. Yes, we're moving in a different way, and the ICB exemplar things, the integrated care partnerships and care boards, are really important in helping. Could we think about the DARSI reports in the context of the pressure that an ageing population, the pressure that health service is under? What are we able to do at both an intervention level? Is there a role that we can play in order that people, unfortunately, in later life who do end up in primary care or in hospital, can they be fitter when they go in? And can we get them more capable of independent living when they come out? And of course, then at a prevention level, can we do more earlier on in order that, people spend longer in good health than ill health across their lifetime? And I think having stronger conversation around those areas would be helpful.
I mean, I was lucky enough, you mentioned it just now, the UK Active ICB meeting in Sheffield a few weeks back now. It felt like a fantastic potential step forward. And I say potential because obviously, talk is cheap and it's about what the actions are rising out of that work. But I think Mike Farrar and Hugh and the team, Kenny Butler, etc., should be congratulated for bringing those ICBs in the room. 6 ICBs all committed to working with our sector and to address some of those things that you've just mentioned there, John. So I think that's, looking forward to 2025. What's next on that?
Well, I was going to ask you, what would your preferred next steps be from in that
well,
particular
for me,
piece of work?
Something that we were talking about, and it did get sort of touched on with UK Active, actually at that meeting, was with Dave Gerish in particular, was the sort of repository of best practice working title. But identifying the examples of things that are already going on. We always talk about prehab for cancer. In fact, not just we talk about it, lots of people use prehab as an example of what can happen when we collaborate effectively, which is fine. And obviously, we're very proud of prehab for cancer, but there are lots and lots of other things going on down the country. But we don't catalogue that very well at all. The Conveners Podcast tries to highlight some of those examples, but we really do need a more formal way, I think. So I think I was quite pleased and enthused with some of the discussions at that meeting that something is going to happen around that. And I think it's something that is tangible there that could work on. I think the other thing that is going on, which needs to join up to the two things we already mentioned, is the Move consulting work with the active partnerships, identifying the health pathways. It sounds like a fantastic piece of work that Craig Blaine and Elaine McNeish are sort of leading on. And I think the next phase of that, I'd like to see that repository sort of be picked up, possibly as part of that work, I don't know. But this is where we need to join the dots, really, don't we? And make sure that's all sort of...
We do, because it's there are some... one of the things that strikes me around that piece of work is there are some exceptional pieces of work that are being done, practice that is going on already in that area.
Yeah.
Are we learning from where it's going well? And what is it that we've got to do to accelerate that and scale it? Because in fact, I might have even emailed you over the last week around the NICE guidance around exercise referral was last updated in 2018 and didn't change its opinion from 2016.
Yeah.
So, we're getting on 10 years. And effectively, in colloquial terms, NICE's view is the jury's out.
Yeah.
There isn't the compelling evidence to suggest that.
Well,
but we think there is.
Well, it's interesting because the conference, one of my highlights was actually going to the conference in Scotland, Edinburgh Napier University, with Dr. Coral Hanson and the team up there, presenting on the standards that they do have for referral schemes in Scotland. But you're right, and again, one of the podcast episodes I talked to Coral there, and to be honest, the data is disappointing.
Interesting.
We have to be honest with ourselves, confront the brutal facts, as Jim Collins says, and say, look, it's not good enough. So having standards, it really shouldn't be a debate, but we haven't got them in England at the moment, so we need to pick that up. But also, we need to be honest, and some of the work that goes on, and I'm going to mention again, the prehab for cancer, some of the work, the ongoing work to refine that program and make it the best it can possibly be, and not accepting some of the ratios that we currently have. And we're performing far, far better than most programs, I'm guessing. I don't know because we don't have the data. Coral does in Scotland, and we're certainly performing better than those schemes. But we need to work together, collaborate, and we need to have the standards, and then we need to improve those standards if we're going to be really taken seriously. So I think the highlight was definitely that conference in Edinburgh Napier. We are having discussions now in GM and beyond to say, let's put a referral-themed conference on. We'll host it, probably in GM, but it's a national conference, and we'd like to see that happen in 2025, so look out for that. But yeah, work to be done on that.
I mean, that's probably would be one of my other highlights. Obviously, we did a piece of work here in Stockport early days where we tried to evaluate a small part of our exercise referral provision, health interventions in the most deprived part of Stockport. Were astounded encouraged, I think, by the results.
Yeah.
That triggered, as you know, Andy, this broader, could we replicate a bigger study across as many parts of GM as we could? And we've got 8 of the 10 boroughs participating in a significant study on the effectiveness of health intervention programs. And the early results of that are, I think we've spoken about before, but we've got enough data. The data set will be more than 2,000 clients. The data that we're getting at the moment is suggesting a real significant shift as a consequence of that physical activity intervention on those people, and we'll be looking to promote that in the new year. I mean, I think that's been a really significant piece of work that we've done in 2024.
Yeah.
But I agree with you. You know, this we need to be far more obsessed about evidencing the impact that we're having and be prepared. When we did that piece of work in Stockport, we were prepared to commit money to something, to find out and be told it's not working, John.
Yeah.
Well, I think that's really important. We've got to be, as you say, confront the brutal facts.
Yeah.
We've got to be prepared to say, to face up to things. You know, what is working and what isn't working, and how do we get the stuff and be really obsessive about using insight and data to demonstrate it.
Yeah, it's a good. That study is going to be a really good discussion point, and we'll certainly pick it up at the referral conference and see where we go from there, along with other impact measures. But just looking at highlights as well, one of the highlights has been the Conveners Podcast.
It has.
It's been fascinating for me, learning lots of things, and I suppose the obvious flagship episode to mention is the Andy Burnham mention there, and the fact that he's such a advocate of physical activity, and he's going to make it central to the Live Well, which is the GM approach there. So there's some really exciting things, I think, that from a regional level that we, GM Active and GM Moving more broadly, can work on in 2025 looking forward, and hopefully that will be the precursor for others as the government are looking to do even more local government reorganisation and all the rest of it. Then hopefully we can continue to sort of push the boundaries as best we can with support from our colleagues in across GM. So and obviously Stockport stuff you're doing here, John. That's you've had a fantastic year in many ways.
I mean, we just do our try to do our best. In this borough that we're working in, and I think that it's the 8th most polarised borough in the UK. We've got affluence and we've got real issues of deprivation. That brings its own challenges. So when we talk about organisations like ours trying to impact population health and reduce health inequalities, then this is what drives us, and trying to think differently about our organisation. And I think this is one of the things, if we're looking at our hopes for 2025, I'd like us to see the removal of the word leisure.
Yeah.
Because I don't think it describes what it is that we do. We're not delivering a leisure service. Leisure suggests that it's privileged and optional. We're delivering an active wellbeing service that is designed to contribute to the prevention agenda, which plays into the sort of national government, and absolutely, definitely plays into, Andy Burnham's words and this sort of live well concept that we're really quite excited about. But the notion of an active wellbeing service, there's more than just the provision of swimming pools and sports halls and what have you, and thinking much broader than that. I think is
that sort of positioning piece, as they call it. We've got to get that right. And probably the final thing to mention as well is, first of all, a thanks for me as chair of GM Active to you for all your continued work on the transformational leadership program. We've got some exciting things we're hoping will come out in 2025. Do you want to mention one of those?
Well, I mean, I think 2025, the leadership program has been great. It's been a privilege to be part of that. And, you're the architect of it. Developing that to mentoring and coaching, I think is really exciting. We've had some chats about that. And I think this, as you and I both share the view, one of the challenges for the sector is around capacity of leadership and capability of leadership. So we've been applying our minds, haven't we, to how do we build greater capacity? How do we build greater capability? We're at that stage where sort of coaching and mentoring is one of those things and I think that's exciting. But Andy, the highlight of the Conveners podcast has been a fantastic for 2024. And I think it's when you set out to do something to genuinely broaden people's perspectives about, just going back to my point about the shift from leisure services to an active wellbeing service, the Conveners Podcast has been one of the sort of critical levers in doing that, and the spectrum of guests that you've been able to encourage to express their views, and that's got people thinking differently. It's brought different and new perspectives, and that can only be it just gives us a great platform to go into the next year, doesn't it?
Yeah, it does. Looking forward to it. We've got some great ones in the can already, and some good people lined up to come on. We just don't have enough time to get round everybody that we'd like to get round at the moment, but we'll see how we go. So, okay, that'll wrap up 2024, and look forward to
Brilliant.
Fantastic 2025.
Thanks,
John. Cheers,
you're welcome. Thank you.